inaugural HACSU Health Debate. The Health and Community Services Union pay our respects to the traditional owners of the land. The Palawa people of Lutruwita are the rightful custodians of Lutruwita, and their sovereignty was never ceded. We stand with them in their ongoing fight for true self-determination and pay our respects to elders past and present. We extend that respect to any Aboriginal or Torres Strait Islander people joining us tonight. Ladies and gentlemen, your host for this evening, the indefatigable Esther Nichols.
I'll have to Google that word. Welcome. What a historic night this is. It is the first ever Tasmania Health Debate presented by HACSU, and it's for you in the lead up to the state election. Tonight is your opportunity to ask your questions and hear raw and unfiltered answers from all three major parties here tonight. Speaking of which, can we please welcome, we've got a live studio audience, Guy Barnett, Liberal MP, Greens leader Rosalie Woodruff, and from the Labor Party, Anita Dow. I am your host, Esther Nichols, and it's been a real pleasure for me over the last 6 months to travel this state, talking to healthcare workers right across it. We've done an entire series on telling their stories and their plights, and tonight is so important for them to feel heard. So thank you, each of you, for showing up tonight. All the questions tonight will be from our members and from you on the live stream as well. So comments, questions, whatever, let us know in the stream. We'd love to hear from you. Before we go any further, I would like to welcome State Secretary from the Health and Community Services Union, Robbie Moore, who made this night possible.
Thank you very much, Esther, and thank you for hosting tonight. And I too want to pay our respects to the Tasmanian Aboriginal community, and thank you for your welcome to country, Lucas. I want to especially obviously thank Guy Barnett, the Health Minister, the Labor Shadow Minister Anita Dow, and Rosalie Woodruff, the Leader of the Greens, and also the health spokespeople for coming along tonight. But most of all, I want to thank the health workers that are here tonight. You're the ones that do the job day in, day out. And today is really just an opportunity for some health workers and others, if we have time, to ask some questions so that we can ensure that health is the most important issue at this state election and that people end up voting to make our health system a lot better. So I'm not going to say anything more than that other than to hand it over to Esther to host tonight and to hopefully, let's hopefully hear a lot of commitments for our health system moving forward. Thank you.
Thank you, Robbie Moore, State Secretary of HACSU, again for making this night possible. A little bit of housekeeping. I'm a little bit of the fun stopper tonight, which I don't thoroughly enjoy, but we're going to try and keep answers to 2 minutes. We'll rotate as to who gets to answer first, second and third. You can rebut at the end of each question once everyone's spoken. We'll also take some comments from the live feed. There'll be a Facebook quickfire round, so just quick responses. And then you'll be able to conclude at the end. Sound good? Yep. And no questions off limits, right? No.
Of course not.
Okay, we'll start with you with your opening statement, please, Guy Barnett.
Well, thanks very much, Esther, and to Lucas and Robbie, thanks for the warm welcome. It's really great to be here. Congratulations on having a forum like this. Health is the most important thing to our family, to our friends, and to our community. It's a top priority, and certainly I'm very personally committed in that regard as well, but certainly since we've been in government 2014, we have delivered 298 hospital beds, 2,500 more healthcare workers, front line, back line, and they are so important. I've often said they are awesome, and they are. 1,390 of those nurses, and of course 220 AMBOs since 2014. And there's clearly a lot has been achieved, but a lot more needs to be done. And that's what we've outlined. During the course of this campaign, we've delivered about $500 million of infrastructure upgrades. So 187 down here at the Royal Hobart Hospital, 175 up in the northwest coast, and 54 million for a near doubling of the emergency department at the LGH. On top of that, the Northern Heart Centre. I'm really pleased and excited about that, 120 million. But of course, none of that infrastructure would work unless you've got the people to do the job and the healthcare workers. And in terms of AMBOs, so we are, first of all, made a commitment to 78 new paramedics and 51 new full-time over the next 2 years, and 27 community paramedics. So that's the biggest blitz that we've seen in history, and that's going to happen under a re-elected majority Liberal government. So you've got 24 paramedics in Greater Hobart, and then out at the superstation that's being built at Glenorchy, which is great to see that progressing so well. I've visited there a couple of times. And likewise, we've got in Launceston, there'll be 12 paramedics additional. Cygnet and Snug, we've got 2 branch stations that will be built, and also Smithton, where I was a couple of months ago. We're recruiting the 27 full-time community paramedics for rural and regional areas. I just wanted to give you a heads up on that over the next 4 years, and that'll help treat Tasmanians in their own home, and also likewise at the hospital, at the rural and regional hospital. So we're looking forward to doing that. They'll be supported with the Royal Hobart Hospital with 44 new GPs and 25 new nurses. So we need the people to do the job. That's in the emergency department. And on top of that, we have what you'd call a GP Now guarantee. A GP guarantees. You've got 10 state-employed GPs that will be used where there's been market failure in the community. On top of that, you've got the 40 extra GPs in the rural and regional parts of Tasmania, where they'll have their HECS fees paid off over that 5-year period, so $100,000. That's a big commitment. We're really excited about that. And then $250,000 grants to GP practices in the community. And that's because 4 out of 10 Tasmanians who present to an emergency department are not emergency. And they can be cared for, many of them, by a GP in the community. That'll take pressure off the ED. That'll help Tasmanians see a GP. When they want to see a GP, they need to see the GP. So we're going to help make that happen with that GP guarantee.
We will have some more questions on that. If we could move on to you, just with your 2 minutes.
Sure, thank you.
No
Thanks
worries, you have plenty of time to talk, don't worry.
No problem.
Rosalie Woodruff.
Thanks, Esther. Hello, everybody, and welcome. It's nice to see so many familiar faces. I also want to acknowledge that we are sitting here tonight on stolen land, the land of the Palawa Pakenham people, and I recognise and respect elders past and present. I also want to say hi to Helen Barnett, who's a Greens candidate in Clark, who's sitting here, an allied health worker, a passionate person, career health worker. When I started Parliament 8.5 years ago, ambulance ramping in Tasmania, the data would show, was 8%. And now we are at a situation where ambulance ramping is 50% of ambulances are ramped across the state, and 40% across the state, 50% of them in the Royal Hobart Hospital. It's been a dramatic change. When I started as an MP, I heard a relentless drumbeat from the Liberals about the broken health system, and now I look at a failure to invest and a failure to plan, particularly for staffing. Despite the calls of HACSU, despite the calls of the ANMF for the last 8.5 years, and what I see is a system which is truly in a desperate state. What I've seen is a step change in the pressure on the emergency department and the impact it's having on particularly paramedics, Ambulance Tasmania staff, as well as nurses, and obviously everyone else in that situation. What we heard was a complete failure from the Liberals to answer questions over about the last 4 years of estimates, trying to find information about what was happening from the stories we were hearing from paramedics and patients and nurses on the ramp, impacts to patient care, and the impacts on paramedics. And we got radio silence. No information about Code Blues was kept. There was no information that could be shared with members of Parliament. Nothing to say here. And it was only last year in estimates that we started to get the information that was actually of what was happening, and that led to us pushing for and finally getting the ambulance ramping inquiry. And I'll say more about what's happened as a result of that, but it was a privilege to listen to the voices of paramedics, of patients, of nurses, of allied health workers who told stories to the public that they had never been able to speak before. It was life-changing for me. I think it was life-changing for anybody who listened to those stories. The real heartbreak every day of people who are working in the health system, the moral injury to people who are working in unconscionable situations, and the damage and deaths that are occurring as a result of the underinvestment. These are the stories that have led to cracked open the situation of what's really happening in Tasmania's health system, and it's given many opportunities for change, and that's what the Greens are very passionate about following up and progressing at the next election, and I think that's two.
We are 3 now. It's changed already. But we will hear from some of those people that you're speaking about. That is what this live stream is for, that's being put on, is to hear their stories. I'm not here to really ask the questions, just to facilitate that. On to you, Anita Dow.
Thank you very much, Esther. And it's my great pleasure to be here with you all tonight, and thank you very much for inviting me to be part of this forum. I too would like to acknowledge the traditional owners of the land on which we're meeting tonight and pay my respects to elders past and present. It's been a great privilege for me to be Shadow Health Minister over the last nearly 3 years, and during that time I have worked hard to work closely with HACSU and your members to raise issues that are important to you, and I give you my commitment tonight that a Labor government will continue to do that. That is one of our key priorities, is to work with you, listen to you, but most importantly to work together to repair the health system. It's going to take a team effort to repair the damage that's been done after 10 years of a Liberal government in Tasmania. The health system has eroded over the last 10 years. Our workforce is at an all-time moral low. Really, it is only their goodwill which is keeping the health system going. And I concur with Rosalie when she talks about the profound impact of the ambulance ramping hearings that I too have been part of and listened to intently, and it certainly left an imprint on my mind and in my heart as well, that our healthcare workers, as a former nurse, are going through what they're going through at the moment each day as they front up to work. And I have worked really tirelessly to highlight the need for more permanent employment opportunities, particularly for paramedics across the health system, and that you will see that as part of our health policies that we announced, that we would never announce numbers of healthcare workers that we would recruit without that being underpinned by a recruitment and attraction policy. And you saw that with the announcement of our workforce plan just last week, where we made the commitment to make 500 healthcare workers across the state permanent. Up to 25% of our healthcare workforce are on short-term or casual contracts, and that's completely unacceptable. And it does nothing to make people want to stay and work and feel valued across our health system. So that's our priority, and my commitment to you tonight, that is something that a Labor government would do from day one. We would also employ 168 more paramedics across Tasmania, which is recommended in the government's own report, which they've only chosen now to start talking about and implementing workforce numbers from. In the first, up until mid-2025, we would employ 87 paramedics. We'd also employ an additional 3 community paramedics across the state in our first year of government, those being located at St Mary's, where we know that there's been issues there around access to a GP, at Claremont and at Mowbray in the north as well. And of course, we've got a $45 million infrastructure fund as well, which I will speak about later, which will see investment in vehicles and infrastructure for our ambulance service right across the state. So it's great to be with you, and I'm looking forward to your questions.
Thank you, Anita Dow. And that concludes our opening statements. Now to our first of a few live audience questions. And of course, we're going to get to your questions on the stream as well. So I can already see people writing some questions up there. We will get to those as well, and as many of them as we can. But right now, the first live member question comes from Cameron Johnson, a paramedic. Cameron.
Good evening, everyone. My name's Cam Johnson. I'm a paramedic in Hobart. Thanks to the panel for coming tonight and participating and having the opportunity to ask the question. It's fantastic. In 2023, the Tasmanian Parliament held a parliamentary inquiry into ambulance ramping, or also known as transfer of care delay. The committee received dozens of submissions and heard harrowing testimony from first responders, hospital staff and health consumers. The committee was highly effective in not only shedding light on the operational issues involved in ramping, but also those work health safety issues, interpersonal conflict, reporting deficiencies, and the dysfunctional culture in the ambulance service and the state's hospitals. It's a shame the committee's work was put on hold when the election was called. My question to the panel is, if you are successful in this election, would you reconsider, would you consider reconvening the ramping committee and, furthermore, also consider holding an inquiry into ambulance services in Tasmania to shed some light on the ongoing resourcing, staffing and cultural issues?
We'll start with you, perhaps Rosalie Woodruff.
Well, thank you. As the chair of the inquiry, we were very close to starting work on a final report, and I can say for myself and the Greens, we are absolutely committed to go back into Parliament and to work with Labor and to work with the other members who are on the committee and the Liberal Party, and to make sure that that committee is reconvened. Obviously, it would be desirable to have a similar formation of members, but fundamentally the work has been done, the evidence is there, the submissions exist, and none of that will be lost. We have to have recommendations that are watertight and very clear. There's no room in my mind for intangibles. I think they have to be very direct and clear because that's what people have told us. And it's obvious that there's not just a situation on the ramp, it's obviously a whole of hospital issue, it's a patient flow issue, it's also preventive health at the beginning, and it's obviously also discharge and working with aged care and NDIS and families at the other end. We recognise the complexity of what is going on, but we also recognise that there is tiered layers of risk in the community where people who are waiting for a 000 call and it's unanswered and they're on their floor at home are at the highest level of risk. And we recognise that people who are on the ramp are at the next highest level of risk. And then there is people in the ED department, and then there's people in the hospital. There's a whole system here, but we have to be directed to make changes across all of those parts, not just focus in a reactive way at one part of the system.
Thank you for that, Anita.
Thank you, Esther. Look, absolutely. Rebecca and White and I have written to Robbie Moore, your State Secretary, giving that confirmation that we would proceed with that committee and want to see that continue, want to see the recommendations handed down and ultimately acted upon by the government of the day. It's really important that that work comes to completion. With regards to an inquiry into particularly the culture, I think that would be a great idea, and we would support that as well, because what became abundantly clear to me as we heard all of those people that presented to us during those hearings speak was that there are some deep cultural issues across the health system, across the ambulance service, and it is time that we looked with a laser focus at how we can make positive changes for people, because people will continue to leave and burn out if we don't do that. So yes.
And to you, Guy Barnett.
Yeah, thanks firstly to Cam for the question and for the commitment that he's provided. And I just wanted to say, as Minister for Health, I welcome the inquiry when it was established and continue to do so. We've monitored it very carefully. In fact, my own department's made a very substantial submission, as you probably know. And so the work of the inquiry has very much been appreciated by the government. But the other thing in terms of that decision, that's a matter for Parliament. Parliament will need to make that decision. But I want to say we have not waited. We've acted. We've already appointed an expert panel, which started last year, the second half of last year, still working. They've got an interim report at Christmas. They'll deliver their full report in March. But at this stage, let me be very clear. At this stage, we are the only party that has a commitment to end ramping. We have given that commitment. It's an effective ban on ramping. It's a commitment to end ramping. We have worked with HACSU, with Robbie and the team here in a collaborative way to deliver a protocol, which is a 60-minute protocol. And that is now planning to be rolled out in coming weeks across Tasmania. We then, in the second half of next year, have a plan to go to 45-minute protocol and then to 30-minute protocol the following year. That is effectively the end of ramping in Tasmania. We've given that commitment, and that's what Tasmanians are concerned about, and that's why we're going to deliver on that commitment.
Would anyone like to have any
Yeah,
rebuttals? Okay, go for it. It's
I
yours.
am really uncomfortable with what I consider to be a deeply dishonest answer from Guy Barnett there. The ramping has always been defined in Tasmania, as it has under the Australian College of Emergency Medicine, as an ambulance waiting for longer than 15 minutes. That is not a definition that you just make up and wish away. That is a definition. And so
That's not the definition.
Yeah, well, it's the definition that your government has been using and reporting to and trying
My
to...
Department of Health has delivered you a submission and it says 30 minutes. That is best practice across Australia. It's applying now in the ACT. We can do it in Tasmania.
That is not the definition of ambulance ramping, though, and that is
Read
not
the submission.
the definition. Well, you can't just change the goalposts and change reality
That's in
that
my
way.
Department of Health
So we'll have to
submission.
agree to disagree, and the experts in the room might have a view themselves. The point is, anything longer than 17 minutes has been shown by the Victorian Department of Health research to have adverse outcomes on patients. And so we have to be doing everything we can to make sure that people get into a hospital bed, they get diagnosis, treatment, pain relief and care that they cannot get on the ambulance ramp. 30 minutes is not good enough. We should obviously be aiming for people to be getting the treatment they need immediately they get to hospital.
Thank you. And I think that, ambulance ramping is much more than a three-word political slogan, Guy. We've just talked about, the consequences of that, the systemic issues that arise through ambulance ramping. It's a symptom of a health system in crisis, a symptom that has developed during the term of your government because you haven't addressed the issues right across the health system and you've under-resourced the system now for many, many years. We support the transfer of care offload protocols. Absolutely, we do. And I understand that they are part of the agreement.
That is very good to hear.
They are part of the agreement that you have with paramedics across this state through their industrial agreement. So, of course, you should be honouring that and putting that in place.
I'm glad you support it.
But we also support
to move to 45 minutes, then to 30 minutes and
putting more
ramping.
resources across our hospitals, whether that be in the emergency department, whether that be through discharge planning, the employment of pen nurses again in our EDs, because there does need to be additional resources to then try to address the flow issues across the whole entire health system, which is what will continue to occur anyway. Those things won't stop. They're still there.
They must stop.
And they're all
we
part
must
of
improve
the health
it, and we have a commitment to do so. We're the only party to do so. Where is your solution?
We've outlined a number of policies around our immediate action
Where is
plan,
your solution to end
which is about
ramping?
doubling the amount of hospital in the home beds, investing in PACER, or the Mental Health Response Service, right across the state.
Clinical coaches,
Will
discharge
it end
nurses.
ramping?
If you have
More
just
allied
joined us, this
health.
is the first ever
Always
Tasmania
politics with the
Health
If it was
Debate.
that easy, why didn't you do it last year? Why didn't you do it 8 years ago? If it's that easy, why are you waiting for an election campaign
It's not
to do
easy.
it?
Let me say it is not easy, and that's why we're collaborating with HACSU to deliver on the 60-minute protocol, which I've heard tonight that both Labor and the Greens support. That is really good news that you hear and you support that protocol. We're going to move to 45 minutes and then in the following year to 30 minutes. That will end ramping in Tasmania. We have a plan. It's a holistic plan across the health system, including in the community, taking pressure off the health sector in the rural and regional areas in particular.
We've had 10 years. If you haven't fixed it by now, you never will.
Don't give up.
We are joined by,
I'm
if
not
you have
giving up.
just joined us, Liberal MP Guy Barnett, Greens leader Rosalie Woodruff, and from the Labor Party, Anita Dow. Before we get to our second live member question, we've got, please send us your comments, questions, observations, whatever you like. We'd love to hear from you, and we will get to as many as possible. This one comes from, this is a quick fire round, so really quick responses. This one comes from Peter Fraser, who says, all medical professionals know that the health system is so broken after being neglected for so long. What are your realistic plans to keep it together, assisting nurses from burning out, finding managers who actually give a toss? Anyone want to respond?
Start at the top. There's been no planning, and there needs to be a recruitment and retention plan, and the Greens have got a big one that we launched with the CPSU, and that's across the whole of the public service, including all health sector workers. That's how we need to be looking at getting incentives to bring people back into areas. But fundamentally, there's got to be a big amount of money investment going into staffing, as well as operational infrastructure. It's a complex picture, but in simple terms, we need more staff, we need more planning for staff, and we need more money to go into the system, which is why we don't support a stadium being built. That money should be going into the health system.
Let's go to our second live question that we have now with the president of HACSU. Thank you so much. A nurse since 1975? 72, damn. And still going. Amazing. Your question for the panel, please, Judy.
I'm Judy Richmond. I work at the Mersey Community Hospital. For many years I was an emergency nurse. I'm currently an after-hours coordinator, and the job mainly is involved with patient flow or lack of patient flow and staffing issues. So as an ex-emergency nurse, we hear a lot about ramping, but we don't hear enough about the causes of this bed block. One such reason is that we admit patients 24/7, but only discharge when the system is resourced Monday to Friday, 9 to 6, with very little discharges happening over the weekend. And also we have a lot of people waiting for aged care beds, and the NDIS that's come in months waiting for all them to get a package. What strategies are you planning to implement to allow for greater patient flow?
Great question. We'll start with you, Anita Dow.
So we announced our immediate action plan, which is to do just that, start addressing patient flow issues across the health system, and that started with working with the federal government to bring forward funding for the hospital redevelopments across the state, because those major developments have stalled under this government, and we want to see those projects given priority and the funds invested and the extra beds created. In the short term, we will, as I said, employ 500 healthcare professionals permanently. It's a way of valuing them. But we'll also employ patient flow commanders across our hospitals, more discharge planners, psychiatric emergency nurses as well. We'll invest in PACER. We'll double the amount of hospital in the home beds. We'll employ more community paramedics as well. And we'll also invest in our regional and district hospitals. So we've had our regional health plan out and about in the community now for a long while, and that we think that we can better utilise the many subacute beds that are available across the health system, across the 18 district hospitals. We're also employing more community health nurses across community health centres to provide more in-home care to patients, keeping them out of hospitals. I've got a community nursing background, so I understand the importance of investing in community-based services. In Launceston, we announced a plan to next year open 20 additional beds up there that are subacute beds to take pressure immediately off the Launceston General Hospital to assist with patient flow, and that would be particularly for patients, Judy, around subacute beds with ageing patients, but also those waiting for NDIS placements as well. So they're just a couple of examples of things that we have outlined that we will do around those particular issues. There's obviously more that can be done, but they would be our immediate priorities.
Move on to you, Guy Barnett.
And thanks very much, Judy, for the question. Of course, from the Mersey, where we're just partway through a $40+ million construction work there to upgrade the hospital, and it's on the back of a commitment that we've given $174 million in infrastructure upgrade for the Northwest alone, so Northwest Regional and the Mersey, over coming years. This is a commitment we've made. It's costed, it's budgeted, it's in our plan. This will happen under a re-elected majority Liberal government. In addition to, and I haven't heard any commitments to meet or match our infrastructure commitments as yet. Look forward to hearing from them tonight, perhaps. But in terms of attracting nurses, midwives, there's a $15,000 commitment for the transfer allowance from the mainland or elsewhere to Tassie, and then and they have to work here within the system for 3 years. Likewise, in terms of nurse graduates, a $10,000 allowance or scholarship to keep them in the health service for that 3-year period. I just want to totally agree with you on the holistic approach, a whole of community approach. It's not just in the EDs where we've got the plans to deliver, like, you know, nearly doubling at the LGH, increasing the capacity by 30% at the Royal Hobart Hospital, backing in the 44 new doctors, the 25 new nurses, but it's in the community. That's why we have a GP Now guarantee. And I set that out a little bit earlier, but we're going to get more GPs into the community and to provide that support in the rural and regional areas and outer metropolitan areas. What's happening is that the federal government has let us down in terms of aged care, and you mentioned NDIS in your question, and disability care, getting them out. That's where the bed block is. That's a big bed block, but we aren't waiting for the federal government to act. We will keep lobbying the federal Labor government, of course we will, but we are acting. We intervened at St Mary's, we intervened at Bridgewater, we intervened at East Devonport, and we stepped in as a state Liberal government, much to the surprise of many, because we know that the healthcare is required in the community. You take the pressure off there in terms of those 4 out of 10 that go to emergency department aren't emergency. Of course, that pressure will be taken off, and then getting the bed access and flow through the hospital is really important. So I agree with that.
Ask one question though. All that infrastructure and all the car parking, we don't think there's going to be any extra inpatient beds. We went from 110 beds down to about 50.
That's right.
Oh, that's right.
Yes, so thank you very much for the question.
There's a great big administration block plan, there's all these extra things, but we're interested in inpatient beds.
Yes, well, we've delivered 298, as you can see from the last 10. No, across Tasmania. Well, yes, that's right. So there will be that's all part of the master plan, and I don't have the master plan with me tonight, but it's a part of the master plan, and there will be over time absolutely more beds. It's no good just having the infrastructure. This is going to deliver, you know, the surgeries, the inpatient, the outpatients. Obviously, the development at the Mersey now is going to help the outpatients, but there will be other support. We need the theatres, and of course we need the healthcare workers to deliver on that, and that will absolutely be delivered as and when required in the time ahead.
Moving along to Rosalie Woodruff.
Thank you. Yeah, there is a whole package of extra staffing needs, and we supported the ANMF's call for 120 extra nurses a year until 2030, ED navigators in all the hospitals, and more discharged nurses, obviously working with the community, aged care and NDIS and families, the PENS, but also the operational staff in the hospitals, and that's what we heard on the ambulance ramping inquiry, the cleaners, and people who are a part of helping to move people through the hospital in an efficient way. There's not been any focus on that, and that's a big gap. And with regard to paramedics, we've got our commitment to the ORH reports, 187 paramedics extra until 2030, but also the 50 extra support staff. They're so critical. The triage, the people who do triage and dispatch operators, they're also admin people. They're also a critical part of having functioning services and having things working efficiently. We have to have more beds. Obviously, we have to have more beds, and we support infrastructure calls and the Labor and Liberal parties' commitments to investing in infrastructure. That's critical. That's why we know that it's important to be putting the money into those sorts of infrastructure, not into building a stadium. We just don't have the money in the budget to be able to do both at the moment. With the services in the community, that's why we need these new ambulance stations, 6 new stations, 13 stations upgraded around the state. And the Mersey, the Northwest Regional Hospital, LGH, RHH, and all of our community hospitals need to be have more beds and have as much capacity as possible, so that there's better options that we heard in the ambulance ramping inquiry for how we can use our regional facilities better. At the moment, they're being underutilised, and particularly we can be getting so much more out of that will take the pressure off our major hospitals and help people move through more efficiently.
And I think,
Can I just to add one thing, which was in response to the availability of services across the hospital that don't operate over a weekend, which then can make it difficult for discharge, or even, say, for example, allied health. Yes, I know.
Well, that's right.
So that's something that we do want to look at in government, and we would make that a priority to look at how we could extend that across the hospital settings, across each of the major hospitals across the state. And when it comes to recruitment and retention, we also have outlined a policy around free degrees for 200 nursing and midwifery students, and to play for their clinical placements as well, as part of a plan for the first year of us being in government, as a recognition of getting them to stay in the state for 3 years, and the importance of offering incentives. Just wanted to add that.
The Greens would be pushing to pay $5,000 a year off the debts for all new university fees for all new graduates. So we think that's like a cheap cost for the state and the incentive that we need to get people to be working in those areas.
And our commitments have been costed, they've been budgeted and sent to Treasury. We're awaiting the commitment, not just the commitment, but the delivery of those initiatives from the other parties to Treasury.
Done that.
And make sure that they are independently assessed by Treasury.
Intention.
Don't worry, we're not.
It's your intention, but you haven't done it, Anita. It's time to step up and deliver your initiatives, costed and budgeted. Well, it's, 13 days till the election. Come on.
Esther.
if you've just joined us, I like the awkward pause. If you have just joined us, this is the first ever Tasmania Health Debate presented by HACSU in the lead up to the state election, 13 days away. And we are joined by Liberal MP Guy Barnett, Greens leader Rosalie Woodruff, and from the Labor Party, Anita Dow. We're getting questions on our socials, so we're just going to get to a couple of those really quickly. This one comes from Sasha, and she says, can you guarantee supply of specialists in the north of the state? Currently extremely hard to find a specialist without having to wait 6 months for an initial consultation.
It is incredibly long wait times to see a specialist across the north of the state. Where I'm from, in the northwest, in some instances, it's the longest in the state. It's a significant issue, and it comes down again to attraction and retention of specialist staff across the state. It comes down to, I guess, the culture across your health system as well, as a place that people want to come and work. We're certainly looking at investing in nurse practitioner roles across district hospitals across the state, which we think will help with the management of chronic disease better in those local communities, which you would hope would prevent people from having to see a specialist after that point in time. But it's certainly something that is high on my list as the Shadow Health Minister, as an area that we certainly need to look at. We'll have more to say throughout the campaign around particularly our medical workforce and how we plan to attract and retain them and offer more specialty services across the state. But it's not good enough that kids are waiting 3 years to get grommets in their ears and having developmental delays because of that, and not ready for school because they can't get access to an ear, nose and throat specialist in the north of the state, and that needs to stop.
I'm happy to concur that it's tough at times to get to a specialist, and that's why we have a plan to provide better attractions and support. And one way to deliver that is through the public-private partnership. So, private hospital in Launceston, we've committed our $35 million commitment on behalf of the taxpayers, which is, I think, a better deal for Tasmania. At least Labor does support the private hospital, which is good. In Launceston, so it'll be co-located, and you'll see benefits there. It'll help attract specialists and other medical health professionals. Obviously, on the northwest coast with the Rural Medical Workforce Centre up there, we've increased funding in past years. We see that as very important in terms of training and development and education. And if you can train them there on the northwest coast, then often they will stay there and live there. And I think that's a plus as well. So, look, there's still more work to do in that space as well, but it's absolutely acknowledged.
Well, yes, we do support getting specialists into these areas, and I think there's been frankly a miserliness on the part of the Liberals in government. Spending the money on locums is not an efficient way of spending limited resources, and so there has to be a commitment to putting people on staff and to solving the housing problems. The critical issue is one of many critical issues for people in regional areas trying to attract health professionals in regional areas. Like in other areas, child safety is another area where in the northwest it's very, very difficult for people to find housing. So there's a package of things that in our view the Liberals in government have refused to pick up. It's been discussed for years, the expense that's been spent on locums. It's a misuse of money, and there should be a commitment to having more of these people permanently employed.
Sasha, thank you for your question on the live stream, and comments, questions, we'll get to as many as we can. I can see them flooding in. Right now, though, let's get another question from Zoe. Hi, Zoe.
Hello, my name's Zoe. I'm a pharmacist at the Royal Hobart Hospital, and my question is about allied health professionals. So there is a chronic staff shortage across all allied health professionals within the Tasmanian Health Service. Allied healthcare services are being retracted due to insufficient staffing, which is not only putting patient care at risk, but it's worsening the bed block situation. We are unable to retain current staff due to loss to burnout or moving to jobs interstate. We are also not attracting new staff, as wages for allied healthcare professionals are not competitive with our interstate counterparts. What are your plans, both short and long term, to solve this staff shortage crisis for allied healthcare professionals?
Perhaps I'll kick off, if that's all right, and thank you very much for the question. Really appreciate that. Very important part. I'm married to an allied health professional, speech pathologist, so in that space. But first of all, in terms of pharmacists, and particularly I just wanted to make an announcement tonight that we will be providing a market allowance to pharmacists. We have heard, we have listened, we've responded. In terms of retaining and keeping our pharmacists, and we will provide that market allowance. So I just wanted to make that commitment tonight under our re-elected majority Liberal government. And we've got the $22 million development here at the Royal Hobart Hospital in terms of pharmacy, and those involved would know that work is well underway. I've visited a couple of times now, and that's really good to see. In terms of allied health professionals, we announced and have underway scholarships and support because they are important, and so that is up to 45. We've now attracted 33 under that program where it's an attraction. Just from memory, I'm pretty sure it's $25,000, so the $15,000 up front and then $10,000 after the 3-year period to be working in that space. They are important, they are valued, and that's rolling out now, and I'm sure that will continue to make sure we get those numbers up and to where they need to be. Tasmania's healthcare is important. There was a mention about funding. We are delivering record funding in health. It's $8.3 million a day. It is important, and it's not just the money, of course, it's delivering the healthcare services that we need, but it is record funding, $12 billion over the next 4 years, and of course with the commitments that we've given, that will now substantially increase. We are the highest state of any state in Australia of our budget. 36.4% of our budget is spent on health. That's the highest percentage of any state in Australia. That's because it's very important, it's a top priority, and I commend and thank our Premier, Jeremy Rockliff, the former health minister, for helping make that happen. I just came in July last year. I've enjoyed every day of it, particularly meeting the awesome healthcare workers each and every day, and it's a real privilege and an honour to be in that role.
Anita Dow?
Yeah, thank you. Look, I think it's extraordinary that you'd only start talking about implementing market allowances during election period. You've had every opportunity to do that for a very long period of time and been fully aware of the chronic staff shortages across the allied health services across the state, and it's not good enough, in my view, just to be talking about that during election. We would absolutely, and have said this publicly now for a long time, that we would implement those market allowances in recognition that they go some way to attracting and retaining allied healthcare workers across the state. Last week we announced that we would fund the free degrees for 50 allied health professionals in our first year of government, for them in return staying in Tasmania to work for 3 years. There's another way of providing incentives also. We'd also hold a workforce summit once elected to government to look at working with the university, with the union movement, with all of those people that it's important to consult with around workforce development across the health system. And that would be a key priority for us to look at the long-term solutions for that. There are a couple of immediate things. Allied health is such an important part of a multidisciplinary health system. If you want to talk about holistic healthcare, it's fundamental to providing multidisciplinary care is fundamental to a holistic healthcare system. And it's all about keeping people weller in their community, keeping them well supported at home, keeping them out of hospital, keeping them away from joint replacements, all of those things which we know puts pressure on our health system. And, it's too little too late from this government to say that you'd be introducing those market allowances now. Should have been doing it years ago.
Thank you, Anita. On to you, Rosalie Woodruff.
Well, here to market allowances, and it's great to have an election campaign to force these things to change, because there's been no change in this space so far. So we welcome that. Another idea that we've committed to is to allow staff to start their long service leave at the start of the university. The day one of university, you're starting a long service degree. It means that when you come out after 3 or 4 years, you've already, you've got 6 years into a long service degree, and that's a really important initiative, and it's across not just allied health staff, of course, but it would be a range of public sector staff and people working in the health area. The allied health sector had terrible cuts when I became a Member of Parliament in 2015. I think it was in 2016, massive cuts. Regional allied health workers, allied health in inpatient and outpatient services disappeared. And I heard then from people like Helen Barnett and others that we met with at the time how devastating an impact it was going to have on patients' health, not being able to get that in community care and also support in leaving hospitals. And what we have seen is everything that was called for by people working in the sector tragically has come to pass. And this is a case of being told and told and told, and the Liberals have been told and told and told what this will cause. And now we're seeing, across all of these areas, we need a big investment in extra allied health staff in all the areas, and we need to, and I fully support what Anita has said about a workforce summit, because there's allied health specialties where we don't train them in Tasmania, and we have to work out how we're going to do that, how we're going to get them here, what's the plan, when people are going to retire. We need this basic stuff. There should be a spreadsheet. We should know how many people, where they're up to in their career, when they're thinking of going. This is honestly primary school stuff, and we would totally support this happening immediately, so that we can get on and work out what's going to happen and how to make change.
Would anyone like to respond?
Well, we have a workforce plan that goes to 2040, and it was consulted in the community. It's been released last year. We're pleased and proud of it. We've got a plan through to 2040. We've got a plan through to 2040, and we've now just supercharged that big time with the commitments that we've delivered, which will end ramping. Again, we are the party that will deliver the ending of ramping. Haven't seen the solutions from the other side, and we are committed. You've got $500 million of infrastructure commitments. Well, this is the Northern Heart Centre is going to be fantastic for Tasmania and the Northwest. This is the highest incidence of heart disease and ailment in all of Australia is on the Northwest Coast and in the North.
Minister?
This will be built in Launceston over the next 5 years. It's a $120 million commitment. Will you match it?
Where's the McIsaac
Will you match
report?
it? Sorry?
Where's the McIsaac
Will
report
you match
which was
it?
done, the review
Hello?
of cardiology
Will you match
services
it?
across the state? Why are you sitting on that still?
Well, you can't answer the question, Anita.
You can't answer that question.
Let's go to the live
Esther.
stream questions. And thank you so much. So many questions coming through. They're all very important, all these topics that we are touching on. This is for the Health and Community Services Union and everyone that is in our allied health right across this state. And we do have some questions coming through. This one's from Karen Mitchell. Karen says, can you guarantee immediate full staffing in rural ambulance stations, especially with a contemporary model?
Yes, the ORH report, which is a report that the Liberal government commissioned itself and sat on since last April and did not respond to and did not act on, we have endorsed, the Greens have endorsed all of the recommendations from that ORH report, and we're just going by the recommendations, and we would be guided, of course, by the union and in terms of anything else that needs to change. We deliberately didn't make an announcement about which ambulance stations would be built where, because we believe it's important to consult with the union, with workers, and obviously local communities about that. But there's a lot of infrastructure that needs to be built, 6 new stations according to that report, and the range of staff which we've accepted.
So we're doing more than the ORH report. We're delivering a record recruitment of ambulance officers and dispatch officers ever in Tasmanian history. So 78 new paramedics, 51 new full-time over the next 2 years, and then 27 community paramedics. The 27 community paramedics is new. This is in addition to the ORH report. We'll monitor it and see going forward after the first 2 years, and we'll deliver what's necessary. But those 24 paramedics in rural and regional Tasmania, and that was the question particularly about rural and regional hospitals, and they will be able to deliver the healthcare in those hospitals and also in the homes of people in rural and regional Tasmania. They will be able to treat people in the homes, which will take pressure again off the EDs. This is all part of our plan, a holistic approach to deliver better health care for the Tasmanians that need it.
I'm sorry, Guy, you must have got a different report, because the ORH report didn't say 78 paramedics immediately. They said 87 paramedics immediately, plus an extra 100 over the next 5 years, plus an extra 50 support staff. That's what they said. So maybe you've got another report that you haven't released to Tasmanians.
No, this is for the first 2 years, Rosalie. I've said for the first 2 years, and then we'll review that in terms of the people that's required.
So it's not the full ORH report?
No,
So
not the full.
No,
I've said that.
Okay, you just said it was more than the ORH report.
It's more. The 27 community paramedics is in addition to what's in the report.
It's less, but it's more, okay.
Community
People
paramedics.
can make what they can of that.
Well,
Yes.
read our policy. It's all there. Please have a look at it.
We support the RH report as well and have done for some time, and that's part of our paramedic policy. We've also announced our intention to employ the 3 community paramedics, which will extend to 8 over the next few years. Prior to this, we'd announced our regional health policy, which was about investing in our 18 district hospitals, having multidisciplinary teams, allied health, nurse practitioners, rural generalists, working across each of those hospitals across the state, and our intention to employ 21 more permanent paramedics across regional Tasmania as well at 6 sites. We too haven't identified the stations that we would invest in, because we want to work with you to identify where the greatest need is and where those new stations should be and where those new vehicles should be, because you're best placed to know that rather than us.
If you have just joined us, this is the first ever Tasmania Health Debate presented by HACSU, and we love getting your questions, your comments. Please keep sending them through. We do have, and we have been receiving a lot of inboxes over the last couple of weeks, in particular to do with mental health. Obviously, it's a huge issue. You've seen the closure of St Helens, and a lot of these questions that we've had coming in, they're all the same. What are you going to do about it? And the thing that I'm hearing when I've travelled the state is people are saying, why, when we know more about mental health, are more resources being taken away from it? So who would like to start with that one? Anita?
Well, I can start if you like. There certainly is a significant shortfall of mental health beds across the state, and I think we lag well behind other jurisdictions across the country when it comes to inpatient beds. We haven't announced fully our mental health policy yet, and we will, so I won't be able to go into details of that with you, but we'll certainly send it through to you once we do that.
When are you thinking of that might happen?
It'll be over the next few days,
Yeah.
Next week.
You can give us a little preview now.
Well, I can talk a little bit about, obviously, the psychiatric emergency nurses that we will employ across emergency departments across the state. I've already talked about the success of PACER, the Mental Health Emergency Response Service, the fact that we would make that permanent rather than a trial in the northwest, and we would introduce it in the north as well. We've already announced our policy around access to mother baby beds across the state. We would have 4 of those in the south, 4 in the north and 2 in the northwest, and additional community-based perinatal mental health services as well. So that's, we've also got a number of other things that we were doing. I've talked in the past about early intervention and in our schools as well. So we'll have more to say about that over the next little while.
Rosalie.
I was really devastated to hear the stories of people last year as they were talking about the imminent loss of St Helens Hospital and the thousands, according to the psychiatrists who worked at St Helens, the thousands of patients on their books who lost the services that hospital provided, TMS in particular, and the mother and baby units there. The Liberals' response to that was really inadequate, and we're really concerned that there remains many hundreds of Tasmanians who are quietly suffering in the community because of a lack of TMS services, publicly funded TMS services, and I was contacted by another one today. So no one is speaking for these people. They're not the mother and babies, and we need to have, and we have committed to have, an expansion of the mother and baby unit beds and relocated to a purpose-built facility with a community model like a Tresillian-like model. That's what we need. Obviously we need that, but we absolutely need the people who have been let down by the loss of St Helens, and now we've got the Hobart Clinic also not providing these psychiatric services. Really concerning situation, and we've got a gap, a big gap in Tasmania. So we are very committed to finding a solution for those people, and to be fighting really hard for people who usually don't get a voice. It's usually just not there's not the attention on those people, and they are quietly suffering in the community.
And to you,
So
Guy
yes,
Barnett.
mental health is a very important matter for all Tasmanians. I think many of us are connected in some way or other in that regard, but I should also acknowledge the Minister for Mental Health and Wellbeing is the Premier, Jeremy Rockcliffe, not myself, but I'd know that he'd want me to share with you that it is a priority for our government, and to indicate that the mental health plans for the Launceston General Hospital are still in place. They're in the budget. That's on Franklin Street, right adjacent to the Launceston General Hospital. Likewise, at the Northwest Coast, the mental health precinct is part of the master plan, and that work will be underway not too far away. So it is part of a priority for our government, and of course, as Anita's indicated, there's further to go in the campaign, and we'll no doubt Tasmanians will be interested to hear more in due course.
Please keep your questions coming through on the live stream. We appreciate every single one of them. We're going to a live question now with Peter. Hi, Peter.
Well, thanks very much for letting me gate crash this meeting. I'm actually not a member of HACSU. I'm an occupational physician, so one of the doctors specialising in occupational medicine in this state, and one of only 2 left when we used to have 5 or 6. My question, I suppose, relates to strategies in relation to supporting the workforce and their health. I'm aware from looking at Safe Work Australia statistics that Tasmania has some of the worst statistics in terms of serious injury rates amongst nurses and other healthcare workers. We've heard a lot already about mental health issues in the workforce and burnout. My question is, what does each party have in way of strategy to deal with the health of our health workforce? That's occupational health, and how do you see that as a part of the solution? We've already talked a bit about incentives and putting people into positions, but what about looking after the current employees?
Thank you for your question, Peter Sharman there. Who would like to start with that, Guy?
Maybe I'll kick off because it's a really good question, very important. Thanks very much for sharing that, and thanks for your service to the health sector over obviously a very long period of time. The first thing I'd say is because I know it's important, not just to the Secretary but to our government, and that's the health workforce plan through to 2040, and a key part of that plan includes the health and improving the health of our workforce over that period of time. And part of that is culture as well, and I know there's a lot of work that's been going on across the Department of Health in that regard. And I should add to that in terms of child safety training, more than 15,000 members of the Tasmanian Health Service, nearly over 90% have undertaken that child safety training effort, which I think says a lot, sends a statement that it's a top priority for our government, and that's a bit of a segue from the mental health issue, but and health of our workforce. So look, thanks very much for the question, and there's certainly it's a priority for our government.
Rosalie Woodruff.
Staffing numbers, absolute staffing numbers would have, the investment in increasing staffing numbers across all the areas that we've already been talking about tonight is a critical part about, hearing from paramedics in the ambulance ramping inquiry, people are only working, 50% of the time because of the incredible stress that they're under, and they simply cannot be at work full time. So we've got a lot of people who are working across the health workforce at the sub full time level because of the stress. So a total number of increase in staffing numbers, staffing ratios. Obviously, when the ratios, we need to have a ratio of staff to patients, and that has to be capped. And that's something that's been attempted to be negotiated to a safer place for staff and patients for years, and it's not there yet. We think that the way that the health bureaucracy has consulted with staff on the ground about changes in what's happening in the workforce is terrible. It's just appalling. I've heard that across every single field on every single issue. And what's really clear to me is that things have changed really fast at our major hospitals in the last 5 years, with a particular step up in the last 2 years. That was clear from the ambulance ramping inquiry. And the changes, so we've got a system that's been working with a normal situation. That situation is utterly changed, but there hasn't been a change in how, in communication with staff and bringing staff on to what are some pretty extreme responses that are being tried to sort of manage the crisis that we've got. There has to be another way of speaking with staff and involving their voice and involving the union voice. Unions, I hear, are still being locked out of having real conversation, real negotiating on behalf of their members. So the role of unions has to be elevated if we are going to fix our workforce. And finally, I'd say, back to Cam, yes, I didn't answer you, but the Ambulance Tasmania, there has to be an inquiry into the situation there, because it's abundantly clear that there are problems with workforce morale, and there's lots of things that need to be looked into that haven't changed yet.
Well, I need to jump in and say I don't know about people being locked out of meetings or consultations. I've tried to consult. I started in July last year. The first thing I did was to engage directly with the frontline healthcare workers. I met with the unions, the respective unions, respective stakeholders, and I listened. And I appreciated that, and it was a real honour. And as I say, it's an honour to be the Minister for Health, but we are not. We are about consulting, collaborating, working together. That's how we've delivered on the 60-minute protocol in terms of the ambulance ramping. So I give it 100% commitment to ongoing consultation and collaboration with not just the unions, but the workforce and those on the front line.
Anita Dow.
As I said at the beginning of my contribution, you could be rest assured that a Labor government will work consultatively with you and collaboratively with you to address some of these issues across the system. We would look at safe staffing models, particularly across our nursing workforce. As I said, we'd hold the summit, which would look at some of these issues as well. Obviously, we would offer permanency to 500 employees across the health system, which does, I think, give people reassurance that they are valued and does help with psychosocial well-being as well. We've also have a plan to include childcare centres and gyms as part of the master plan redevelopments across the state. we can take away one stress from our healthcare workers around the availability of childcare. That can only be a very good thing for working families. When it comes specifically to paramedics, we'll create a chief paramedic role to sit alongside the chief nurse's role and other chief governance roles across the Tasmanian health system. Culture starts at the top, and if you've got people in those positions in governance roles, then you can implement change, we believe, and understand that paramedics would appreciate having a seat at the table. We'd also uphold the EBA commitment, which I believe the government hasn't done, which is about having wellbeing officers supporting the communications office. My understanding is that hasn't happened, and that would go a long way to better supporting the comms office. And we would provide regular health and wellbeing pulse checks across the Tasmanian Ambulance Service, which I don't think are being done regularly now, from feedback that I've had.
Quick question from Chris Webb, and we love your comments and questions on the live feed as well. This says, which party has a plan to reduce surgery waiting lists, which is putting great strain on the health system? Perhaps we could start with you, Anita.
So last week we announced, as Guy alluded to before, a private partnership which will create more elective surgery beds and space in the north of the state. We also have plans that we will talk more about later on in the campaign around that. But the issue is, I think, with our elective surgery wait list is that we've got about 58,000 Tasmanians waiting to see a specialist. So those people can't even get onto the elective surgery wait list. The government talks a lot about the elective surgery wait list and the reductions that they have made, but that's not a true indicator of how well the health system is going overall. And I would say that our investment in primary health care, nurse practitioners, more resources in local communities to manage chronic disease better should mean that people are weller in their community. That will take time for that investment to see the rewards of that investment, I suppose, for people's health and well-being. There are issues also with just the availability of beds to do the elective surgery across the state. I hear from people that work in our operating theatres and other spaces that just aren't the beds available for patients to be in on the wards after they've had their surgery. So it's a whole of system approach. We've outlined some of our key priorities around making more community care available to ease the pressure on bed block across the state. And we'll have more to say in a little while more around elective surgery.
Greens leader Rosalie Woodruff.
Thank you. Well, elective surgeries have blown out terribly, despite the fact it was the signature thing that the Liberals sort of talked about for years and years. That's had a devastating effect. And we believe the answer is about investing across the health system. As we've been talking about tonight, it's about keeping people well in the community by providing them with preventive health and community health options and allied health in the community. And then when they're in a hospital situation, providing the funding for the specialists so that they can be seen. There is a problem with total number of beds, and that is an issue that we support. The investments that have been proposed by both the Liberal and Labor parties in infrastructure to fix that. But fundamentally, we have to release some money from somewhere else in the budget to go into the health system. And that is the bottom line. And that is the difference between the Greens and the Liberal and the Labor parties, is that we are committed to stopping the stadium being built, making sure that $1 billion goes into essential services like health and housing. We're also committed to taxing big corporations just to make them pay their fair share so that there's more money going into essential services. We've got to get real about this. Our population is getting older. We need to free up extra money. We can't just keep moving it around, otherwise we'll be scratching it out of other bits of the budget. It is a fairly substantial chunk of money that we have to commit into this space. I've heard it on the ambulance ramping inquiry. I've heard the pain of people. We've heard we got the minister and the department secretary admitting that deaths occur on the ramp. That's not good enough. I don't think that's what Tasmanians want, and that's what we're fighting to change, to make sure the money goes into boosting across the system as it's needed.
And your response to that?
Yeah, so there's a few responses there. Firstly, the Greens leader says that Labor has made commitments to infrastructure. Well, nothing like the $500 million infrastructure commitments that we've made, and I haven't heard I haven't heard the details of that, and I'd like to hear more about it, and Tasmanians would like to hear more about it because healthcare is a top priority. In terms of elective surgery, I thank the Premier, former Minister for Health, because last financial year we delivered more elective surgeries, more than 21,000, than any other year on record. And when you compare our admissions to any other state and the national average, we've got 37 admissions per 1,000 population, significantly above the national rate of 28. So in terms of improvement in performance, in terms of seeing patients on time, there have been improvements, and in terms of the number of patients waiting longer than clinically recommended, it's continuing to decrease, and that shows that the system is working. There is more to do. I mean, it's over 8,000, but the rates were 12,000, 14,000 in terms of the list. So we've got to try and get it down. And as I say, I thank Jeremy Rockliffe for helping deliver that record effort some time ago. I want to concur, at least with my colleagues on the table here in terms of preventive health and chronic disease. And if we can address it there, that's the way to go. I have type 1 diabetes. I know about diabetes. I'm ambassador for Diabetes Australia. And I know we need to do more when it comes to chronic disease and preventive health, creating better habits of healthy, active lifestyles. And particularly building good habits for our young people in the schools, then this will deliver definitely better health system, in the long term. But we've got to deliver the here and now, and of course a plan for the long term.
Just two things, Esther, that I just wanted to add on that. It's only 3 years ago that you were talking about major investment in the Launceston General Hospital, $580 million. We're now 3 years later, we're at the next state election, you're still talking about investment in the Launceston General Hospital, but really nobody's seen any real investment from your government in the Launceston General Hospital. So I don't really think you can be critical about alternate parties talking about investment in infrastructure when your government has failed to deliver. The same at the Northwest Regional Hospital. All you've got's a master plan on a piece of paper. That's all there is.
Well, you obviously haven't been walking through the Women and Children's Ward at the Launceston General Hospital, which I've done twice, and it's been built, which has been built in the last 4 years. And we rebuilt the Royal Hobart Hospital. Labor did not lay a brick. So your record is abysmal. You cut the budget for health under your government. You cut the health budget. We've increased it by double. We've employed 2,500 more healthcare workers. We've delivered 298 new beds, and we're going to do a whole lot more.
The health system's completely broken.
Thank you for joining us on the live stream. We are going to be wrapping up shortly, but we still want to get your comments, your questions. And I should say all the live member questions that we've asked tonight, they will be sent out to the independents as well. And any responses we get back, we'll share on the HACSU socials. But right now for our last live member question, Frank Formby.
Yeah, thank you. Thank you very much. I'm getting the feeling that I know already I'm a palliative care specialist, and I've worked all around Tasmania and interstate extensively. I think the tasks that you've got before you are very difficult, and there aren't any particularly easy solutions. One quick observation, then I'll ask my question. My observation is without a coordinated system change, rather than looking at things piecemeal, then throwing more money without that will be less efficient than it could be, because the system's not running as efficiently, but it's still using the same amount of money. Now, so my question is, have anyone looked at other jurisdictions, as was recommended in one of the numerous reports that have been around for the last decade, and particularly Christchurch, which I believe is an impressive model to follow. It's not perfect by any means. Thanks.
Great question. Rosalie, would you like to start?
Frank, could you add other systems for what? Other health systems?
Yeah.
Other total ways of reshaping the health system?
Well, not total reshaping, but
just like
reorganising. Yeah.
Well, I'm slightly aware of Christchurch, and it is lauded as a really excellent system. And look, I'm, as somebody who's been watching and trying to hold the government to account, I can say as an epidemiologist, it's really clear that there's no planning that's been happening. There's not been the consultation, despite what Guy said. I know that there hasn't been the consultation and the listening with workforce about the sort of changes that need to happen. So there's clearly a blockage between what the government and the department bureaucracy is doing and listening to people who are on the ground about the changes that are happening. I believe from what we've heard on the ambulance ramping inquiry that change is happening really fast in Tasmania. I believe the profile of people who are coming into the hospitals has changed dramatically in the last 5 years, and therefore we do need to have a very big change. I think partly what Anita mentioned about a health workforce summit, is one part of that. But fundamentally, I think we can't, in the next term of government, make any of the changes in health unless the unions and the workforce are really there front and centre, really involved in the department, not just a kind of on one thing after another, but actually sitting at the table, being part of the conversations. Because there is a lot of examples from other jurisdictions. Some of it's Christchurch, some of it's Victoria, some of it's Western Australia. It depends what issue you're trying to solve. I don't think we can just take another place and transplant it to Tasmania, but bits of all of them are useful. And there is a lot of reports. We just need to act on the recommendations in them in the first place. A lot of stuff is sitting there, recommendations that are excellent and they haven't been acted on. That's money and that's leadership.
Greens leader Rosalie Woodruff, on to you from the Liberal Party.
Yes, thanks very much for the question. Really appreciate that. And if you were designing a health system here and now with a clean piece of paper, you wouldn't design it the way it is now. So that's really part of your question. The bottom line is we are where we're at. We have ministerial meetings with our federal minister. Every state and territory minister is always lobbying the federal minister, particularly with regard to bed block. This is the blockage of aged care residents who are actually in hospital and they're stuck there because they've got nowhere to go. Now, federal government's responsible for aged care. They're responsible for the NDIS and disability care. We have a whole ward in Tasmania, 4 major hospitals, that are stuck there because they've got nowhere to go thanks to, unfortunately, the system and the federal government. But we are stepping in when it comes to GPs. So federal government responsible for the GPs, Medicare, obviously hospital funding dollar for dollar or thereabouts. We always need obviously more from the feds and then 3 for medicines. So that's what they're responsible for. Now in the community, we haven't got enough GPs and of course in terms of affordability, the bulk billing rates aren't where they need to be. So we've had to step in. We stepped in at St Mary's, we've stepped in at Bridgewater, we've stepped in at East Devonport to deliver the GP, the medical health care that's required. So we're going to need more collaboration with our federal colleagues. We need them to do some heavy lifting like we've done in Tassie. And then we'll need to collaborate, work together as we have done, and we'll need to do more of that, not just with the unions, but other key stakeholders across the healthcare sector. We've got a plan through to 2040, and that's why there's a whole lot more work to do. You mentioned palliative care, so I'll just finish off on that. Palliative Care Tasmania, we have arrangements and contractual arrangements with them, providing better palliative care in the community. And I must say we've just announced Allambie as the hospice for palliative care in the north, just not far from the LGH. Allambie will be the new home for Northern Hospice Association, and I commend Barb Baker for all her advocacy to help make that happen. It's a wonderful achievement. My late mother was the patron of the Northern Hospice Association, working with Barb Baker. So in terms of palliative care, I can't indicate how important it is, and thank you for the question.
Anita Dow from the Labor Party.
Thank you for your question. It's a really great question, and I've thought a lot about it in my role as Shadow Health Minister, and obviously we have looked at a number of jurisdictions and what they're currently doing to address the pressure points across their health system in our policy development. And really our policies that we've announced over the last week or so have been directed really at an immediate response to the current issues. I would like to think that once in government we would look and work together with unions and stakeholders in the community to plan for better health services across our community. I'm a regional Tasmania, and I'm passionate about making sure that people, no matter where they live, can get access to better health services. Over the years, health services have been centralised in Tasmania, and we have one of the highest decentralised populations in the country. So the current model isn't working, and when I spoke about our regional health plan, that is about providing more services closer to where people live. I have a palliative care background as well, so I place a high value on holistic care and multidisciplinary care, and that patients being at the centre of that care with their family as the unit of care. So I think that there are ways that we can look differently about the way that we provide healthcare across Tasmania. We've had very much an acute focus for many, many years, and there is no doubt there's a need to deal with the current issues across the acute sector, but there is also a dire need to deal with more regionalised healthcare, better community-based services to address the challenges that we're going to have now for the next however many years when it comes to our ageing population and the tremendous chronic disease burden that we have across our state. And we have to think differently about the way that we spend those records amount of funding across our community, because currently people's health status isn't improving. The services that they're receiving, particularly in regional Tasmania, have diminished over the years. And now all of those things combined are really the perfect storm for our health system.
Are you happy with that, Frank?
Well, it's encouraging, yes, definitely.
Good. It was a great question. Thank you so much for being here.
Thank you.
And for asking that question. We're going to have to wrap things up. I'm going to give you each a chance for closing remarks and any announcements you want to make. We've dropped a few tonight. Are more than welcome as well. But thank you very much for being here. It is a very tough issue to talk about. There's a lot of issues, and I think it's undoubtedly one of the most important questions in this state election is what each party and independents are going to do in relation to our health care system and our healthcare workers as well. So who would like to start?
I don't mind.
I'm happy to wrap it up and
Go on,
say
Barnett.
thanks again for hosting us. It's such an important issue for all Tasmanians and our families right across the state, and there's nothing more important. And so, as Anita mentioned in her closing remarks, you know, we are delivering record funding for health, 8.3 million a day, but we know it's so important and there's more work to do. That's why we're delivering record funding again in terms of infrastructure, but there's more to it. It's not just the bricks and mortar. Record recruitment effort with the ambulance paramedics and the like. We know that we need a holistic approach, so that's why we're delivering that. We're doing the big picture with the GPs, with the nurses out there in the community, taking the pressure off the EDs. We're focusing on the EDs in terms of providing the attractions for nurses and midwives and the other healthcare professionals. It is a priority, and so we will continue to do that. We've rolled out record funding in terms of our commitments, and I hope that's acknowledgement of that. And I think we are the only party that has a real commitment and a policy to end ramping. It needs to happen. It's acknowledged, and there's more work to do there, and we will deliver on that through in the community with the GPs, taking the pressure off, obviously in the EDs, access and flow through our hospitals, and of course all part of our long-term plan through to 2040. But we're going to deliver real action, real solutions right now once re-elected.
And on to you, Greens leader Rosalie Woodruff.
The ambulance ramping inquiry in Tasmania has been a watershed, and I think what it's done is it's given a voice to Tasmanians, particularly workers, but also patients and families of people who have died or who've suffered in the health system, which has got to a terrible situation in many parts of it. And that for me really has it's an exciting opportunity, and what it's done is it's because of the voices of people, many of whom are in the room and who are watching tonight, that this election has got health on the agenda, and it's set the agenda. And so we've got both the Liberal and Labor parties agreeing to have with what the Greens proposed, the 24/7 radiology and pathology at LGH. That's just a tiny thing. Agreeing to go towards, not far enough, but heading down the line of the whole ORH report for paramedics and Ambulance Tasmania. These are the sort of changes that we can make. So we are excited about the opportunities for the future. We want to be back in Parliament in a balance of power with more members elected to fight really hard on these issues, to hold the next government to account. We believe that the system is broken under what the Liberals have delivered, and we want a new government, and we want to be there fighting for not just people in the workforce, but for all Tasmanians. We know it is a central issue for people, which is why we've got as our key candidates a GP, a nurse, an allied health worker. I'm an epidemiologist. We really care about health. Some people might have made the mistake in the past of thinking that the Greens are just interested in the environment. We are passionate about social justice and what has happened in Tasmania to our health system, to workers and to people who try and get the health that they need it is a terrible injustice, and it's something that we are committed to fighting really hard to improve. And we know that change is possible. It's obviously not easy, and we're not pretending it is. The Ambulance MP inquiry has shown that things are sitting there, they can be done, it needs the investment, and we're committed to pushing really hard to making sure there's the money in the budget through stopping a stadium, getting the taxing on the big corporations like other states do, so that we've got money to make the changes that people want.
And wrapping it up from the Labor Party, Anita Dow.
Thank you very much. It's been my absolute pleasure to be with you all tonight and to just share some of our ideas about how we can improve Tasmania's health system. I gave you my commitment before, and it still stands, that a Labor government will work constructively with you. We will respect you, unlike this Liberal government, and we want to work together to get better outcomes across the healthcare system for healthcare workers, but also for Tasmanians, no matter where they live. I hope to talk more with you, each and every one of you, about our policies throughout the duration of the election campaign. I think that being a former nurse, I got into nursing to make people's lives better, and I guess that's what I understand most of you in this room are driven by as well, being from a healthcare background. It's why I then got involved in politics, which is to make people and communities' lives better as well. And so why I'm a member of the Labor Party, because we care about people and we want to make people's lives better. And it is time for a better future for Tasmania. We've had 10 years of this government, 10 long years, and the thing that I find incredibly frustrating is it's only at election time that you hear from them about how they want to improve things. And, you know, stopping ambulance ramping is much more than a 3-word political slogan during an election campaign. It's going to take a dedicated health minister who wants to work constructively with all healthcare workers across the entire health system to make sure that we can improve access flow, but to make sure that we've got better community-based services so that people aren't presenting to our hospitals in the first place. It's a whole of system, whole of community approach. I am under no underestimation of how much of a challenge it's going to be to repair the damage that's been done over this last 10 years. But I can give you the commitment tonight that I'm up for the challenge. I know that it won't happen overnight, but I'm willing to chip away at it, and these are some of the immediate common sense solutions that we have to the problems right now that you see across our health system. And I want to work with you to create positive change.
We will have to wrap it up there. Can I say a very big thank you? It was a historic night, the very first Tasmania Health Debate presented by HACSU. It is the members' forum, and we appreciate you all showing up and having some unfiltered comments, questions. And so thank you to Liberal MP Guy Barnett, Greens leader Rosalie Woodruff, and from the Labor Party, Anita Dow.
Thank you.
Thank you to you as well for watching and all your comments, and thank you to the live studio audience as well.
Yay.
I'm Esther Nichols, and thank you for joining us. Have a great night.